Hello everyone, hope you all are doing good. So today I have got you a few questions which are previous year questions from previous year topics. So let's discuss few of the most important questions in medicine which are likely to be shown up in the upcoming FMG exam. So we'll go with the first question. The patient sustained a fracture of his tibia and burns on his legs when his electric scooter caught fire. On day 3rd of examination, he develops respiratory distress. Vitals show tachycardia with wide split S2 and elevated JVP. Chest X-ray is shown, which you can see. Now we have to guess the most likely diagnosis. So option 1 here is pulmonary embolism, fat embolism, nosocomial pneumonia, and heart failure. So most probably the answer should be from 1 and 2. So let's see this question. We can see wide split S2. We can see tachycardia, elevated JVP is given here. The significance of this X-ray here is Hampton's hump. So where can we find Hampton's hump, guys? So it suggests the right heart strain. Whenever there is right heart strain and pulmonary infarction. Okay, these are the typical findings of pulmonary embolism, guys. So we got the answer, which is option number A, pulmonary embolism. Now let's see towards the next question. A person is brought to emergency after bee stings. He has hives all over his body. Pulse is low volume 110 per minute. Cold clammy extremities with BP of 7/50 and peripheral cyanosis. Auscultation shows bilateral conducted sounds with rattling of secretions. GCS is 12 out of 15. This is Glasgow Coma scale. So which of the following is correct about this patient? So options here are suggestive of what are the medications you would use in this patient. So guys, after reading the questions, are you all able to discuss what is happening here? So guys, bee stings are suggestive of what? Focusing on the symptoms given, the airway is involved, associated with rattling sounds. Cyanosis is given and patient gets hypotension, which is 70/50. So the patient is basically under which shock? Yes, it is under anaphylactic shock. And the standard treatment for anaphylactic shock is we give adrenaline 0.5 milligram intramuscular 1:1000 every 5 minutes with 2 liter of saline. So this is the answer here. Option number 4th. I hope you all be able to guess it right. Now let's go to the third question here. So we have an HIV positive patient presents with fever and neck rigidity. Lumbar puncture was done and CSF examination shows lymphocytosis, normal sugar and increased protein. A special study shown below is done. This is the image. Which test is done to confirm the diagnosis? So hint in this question is HIV positive and the given image. Patient with symptoms of fever, neck rigidity, lymphocytosis, normal glucose and increased protein in CSF suggestive of fungal meningitis. So this is a case of fungal meningitis. So this fungal meningitis is commonly caused by Cryptococcus neoformans, which is a common cause when a patient is immunocompromised. Now, can you all able to guess the image shown here? It is the India ink stain, guys, where Cryptococcus neoformans appears as round budding yeast surrounded by clear capsule. So this is the Cryptococcus neoformans and this is the capsule surrounding it, which is basically a halo against the dark background. Now let's go to the question number 4. A diabetic patient sustains a fall since he is not able to walk properly. A NCCT head was done. So we did non-contrast CT scan for head. What is the best step in the management of the patient? So you all can see here the radiograph image shown. Hemorrhage is concavo-convex in shape. So concavo-convex hyperdensity, it indicates which hematoma, guys? Subdural hematoma. We can see the history of fall in the elderly or those who are undergoing anticoagulation therapy. So subdural hematoma is very highly happening in the old people with fall history and who are already going anticoagulation therapy. Next best step in order to manage is to stabilize the patient. So management focuses on stabilize the patient, and consult neurosurgery in order to manage the source of bleeding. So, what is the source of bleeding in subdural hematoma? The vein which are called as bridging veins. We just got the management observation with regular monitoring in case of minor bleeding and surgical management. Secondly, we consult the neurologist to do the surgical management. The minor and major bleeds will decide if you'll go with stabilizing the patient or if you'll directly go for the surgical management. So the option here is going to be option number 4, stabilize and do neurosurgery consult. Guys, in this question number 3, I forgot to mark the answer. So here we have the answer as option number 3, which is India Engstein. Okay, now we'll focus on question number 5th. So question number 5th here is about a 25-year-old young woman comes with weight loss, palpitations, heat intolerance and tremors. She has the following look on examination. As you can see in the image, workup shows decreased TSH levels and free T3, T4 elevated. Which of the following statements is not true about this condition? So guys, after reading the symptoms, they are highly suggestive of which disease? Can you all guess? Yes, this is the typical case of Graves' disease, which causes hyperthyroidism and ophthalmopathy, as you can see here in the image given below, which explains the retracted eyelids, okay, towards the back. Okay, so question is asking about not true. So option will goes as third. Start levothyroxine and monitor TSH after 1 month. This step we do for hypothyroidism. So don't confuse it with that. So option number first, retraction of molar muscle is there. Myxedema will involve peritibial area, correct? And steroids to prevent visual loss, also correct. So not true about this condition is we won't give levothyroxine. Now we'll go for the question number 6 and the last one. So we have an 18-year-old patient, girl, which is presenting with left wrist joint swelling and causing difficulty in working on the laptop. Examination, she has a pan-systolic murmur, guys. ECG shows PR interval prolongation and positive CRP. So what is the most likely diagnosis? Okay. So we will focus on the left wrist joint swelling. It is showing the patient is having arthritis along with CRP is positive. So what will we think? That it is having acute inflammation in the body, in the joint. Okay. Pansystolic murmur is showing some kind of valvular heart disease and the prolonged PR interval. All of them convergently making the diagnosis of rheumatic fever. The condition here suggests highly that the patient is having rheumatic fever. Okay, it is involving heart in advanced forms. It generally involves heart in advanced form. We don't see such kind of symptoms in rheumatoid arthritis or AS or psoriatic arthritis. In psoriatic arthritis, you must see some skin condition. So this is not the condition given here. Here it's only about heart, which is highly suggestive of rheumatic fever. So we successfully did 6 PYQs covering the related information of the topics concerned. Thank you guys for making it up till the end. See you again in the next one. Study smart and all the very best for your examination.